after Health and Human Services Secretary Kathleen Sebelius said the president did not know about the health insurance website's hitches and glitches until it was after 3 weeks ago. Until it was 3 weeks after was launched 3 weeks ago. And I think the president should be ashamed of himself for that. Whether you support this thing or not, he should have ensured that. And now I understand that he has people hired to make sure that the system's working. But, the people that are monitoring this stuff, are supposed to be monitoring this stuff, and didn't run an adequate test, they should have their jobs examined. Okay? Find people that know what they're doing. Now, I'm not saying you're going to be able to predict every possible failure ahead of time, but computer server crashing, they should be able to see that, we'll probably have this many people logging on. As a matter of fact, a friend of mine was checking this out, and at 3 o'clock in the morning, that was the only time he could get through to the health department officials, 3 o'clock in the morning, to enroll up for a healthcare mandate. This is pretty sad in this country that we have to be up at 3 o'clock in the morning to enroll in a healthcare program. Now, he had good reason to be. For one, he was just coming out of a heart attack about a week and a half before that. So I'm sure this was heavy on his mind. But nevertheless, we shouldn't have to be up at 3 o'clock in the morning worrying about a damn healthcare. Well, some Americans said that the website has been anything but stress-free since enrollment began on October 1st, and one survey found that only about 20% of people who tried to log on to government-run healthcare marketplaces, including healthcare.gov, were able to do so without any technical bungles. 20%. That's an abysmal rate. Users have received error messages, the Spanish language version of the site has been delayed, and the government contract for the U.S. division of Canadian company CGI has tripled in cost. Tripled in cost, and what have we gotten out of it? Well, a June report from the Government Accountability Office warned that the website might not be ready for prime time due to a flurry of last-minute changes. So they knew about this 4 months ago, but kept it hush-hush. This is inexcusable, because they knew if that got out, there would have been a lot more protest, including supporters of this healthcare law. Those worries don't seem to have made it to the Oval Office before the troubled rollout began. Again, another miscommunication in an administration that was priding itself. Remember this when Obama ran for president in 2008, and he promised us that there would be open communication on new laws, and that there would be a moratorium to allow people time to express their opinion on proposed laws and so forth, and about situations like this. And his own administration has a lot of miscommunication going on here. We're talking Benghazi, we're talking healthcare law. And yes, I am in favor of universal health care in this country. But if we're having glitches like this is the biggest fuck-up in our history. This is going to hurt a lot of people. A program that was designed to help people is going to end up hurting a lot of people if we don't get this thing straightened out right now. However, with Sebelius responding, "No, sir," when pressed on whether the President and the Health and Human Services had serious concerns about the site before October 1st, quote, "I think that we talked about having testing going forward, and if we had an ideal situation and could have built a product in, a 5-year period of time. We probably would have taken 5 years, but we didn't have 5 years, Cebulus said. We wanted to make sure that we made good on this final implementation of the law, unquote. Well, Cebulus said that she had created an account on the website, but had not signed up for a policy because she already has insurance coverage. The website received about 20 million visits, while others have sought coverage over the phone and in person. I think there are certainly some challenges. It could be smoother. It could be easier to access. And that's really what we're working on. Nobody wants the site that the site is working the way we want it to. Certainly the president acknowledged that yesterday. Cebulus blamed most of the problems on the site on what she called a higher number of visitors. Well, that's part of it. But the government should have been prepared, had its ducks in a row, and had enough servers to accommodate the extra traffic to account for the overflow. But it didn't. Well, speaking of the government, let's see if I've got the story here. Interesting little tidbit that didn't really get a lot of airplay yesterday, as far as I know. But I've been watching network news or cable news very much this week. Nearly 700 employees of the Internal Revenue Service, the IRS, well, nearly 700 employees of the IRS contractors owe nearly $5.5 million in back taxes. That's according to a report yesterday by the agency's Inspector General. $5.5 million. More than half of those workers are supposed to be ineligible to do work for the IRS because they are not enrolled in installment plans to pay the taxes they owe. So about 350 of them shouldn't even have been working for them in the first place. Well, unlike other federal agencies, the IRS requires employees and those who work on agency contracts to comply with federal laws. Now, that means they have to file returns on time and either pay all the taxes they owe or enroll in a payment plan. Okay? Well, Treasury Inspector General for the Tax Administration, J. Russell George, says the IRS does a good job, though, of checking in compliance when contract workers first start their jobs, the report said, but the agency should do a better job of monitoring whether workers continue to follow tax laws afterward. The IRS vigorously checks tax compliance among the agency's 90,000 employees. Contract workers should be held to the same standard, the report said. And I agree. The Inspector General's office reviewed tax records for nearly 13,600 employees of IRS contractors. Now, investigators found that 691 who owed back taxes as of June 2012, the report said, and that some 352 of the workers owed back taxes and were not enrolled in a payment plan for a delinquency rate of 2.6%. Those workers owed a total of $2.7 million in back taxes, the report said. Now, by comparison, the delinquency rate for all federal workers and retirees was 3.2% in 2011. That's according to IRS statistics. The Treasury Department, which includes the IRS, had the lowest delinquency rate at 1.1%. Now, among the general public, 8.2% of taxpayers owed delinquent taxes 2 years ago. IRS employees are held to a very strict standard, even in cases of personal hardship. If they fail to file on time or pay their tax debt, they face disciplinary action, including removal. That's according to Colleen M. Kelly, president of the National Treasury Employees Union, which represents IRS employees. So, now the Inspector General's office said yesterday they are working on a separate report on back taxes owed by companies that have been awarded IRS contracts, which is expected in the next several weeks. 3 years ago, The Inspector General reviewed tax records of 135 IRS contractors with contracts of $250,000 or more. At the time, the investigators found that 20 contractors that owed a total of $5.2 million in delinquent taxes. Now, the IRS, not exactly a favorite federal organization for most people in this country. In addition to being in charge of overseeing our federal tax dollars that they receive them, they are also running this healthcare reform program. Now, if they can't track 700 people properly or discipline them, how can we expect them to do the right thing when it comes to fixing the healthcare website problems? Now, I understand that's more of the Health and Human Services Department's problem, but the IRS is supposed to be overseeing this as well. So there is the conundrum. Okay? Continuing on with what's on my mind for today. Speaking of health-related issues, strokes are increasingly hitting younger people, and the incidence of the crippling condition worldwide could double by the year 2030. That's according to a global analysis of the problem. Though the chances of a stroke jump dramatically with age, the growing number of young people with worrying risk factors, such as bulging waistlines, diabetes, and high blood pressure, means that they are becoming increasingly susceptible. Worldwide, stroke is the second leading cause of death after heart disease, and is also a big contributor to disability. Now, most strokes occur when a clot blocks the blood supply to the brain. Patients often experience symptoms including a droopy face, the inability to lift their arms, and garbled speech. If not treated quickly, patients can be left with long-term side effects including speech and memory problems, paralysis, and the loss of some vision. Scientists combed through more than 100 studies from 1990 to 2010, studying stroke patients across the world, and also used modeling techniques when there wasn't enough data. They found that the incidence of stroke has jumped by a quarter in people ages 20 to 64, and those patients make up almost 33% of the total number of strokes. Researchers said most strokes still occur in the elderly, and that the number of people suffering from strokes are still increasing as the world's population ages. Now, some of the increase we see in strokes is unavoidable because it has to do with people aging, but that doesn't mean we should just simply give up. That's according to Mahid Azadi of Imperial College London, one of the study's authors. Azadi said that countries should focus their efforts on reducing smoking rates further, aggressively controlling blood pressure, and improving eating habits. Azadi said that developing countries such as Iran and South Africa have set up national systems to monitor maternal and child health, are a good model for similar initiatives that could help stroke risk factors, or rather help keep stroke risk factors such as high blood pressure in check. Azadi and his colleagues found that the death rate among strokes dropped 37% in developed countries and 20% in developing countries, largely because of better diagnosis and treatment. Stroke prevalence was highest in East Asia, North America, Europe, and Australia. It was the lowest in Africa and the Middle East. The researchers said people in those regions may be dying of other ailments before they got old enough to have a stroke. In the United States, doctors have already noted an alarming increasing number of strokes among young and middle-aged Americans, while the numbers have been dropping in older people. The research was paid for by the Bill and Melinda Gates Foundation and published online last Thursday in the journal Lancet. Young people think that stroke is only a problem of the elderly, so they need to improve their education about the condition. Okay. Other researchers, such as Dr. Yannick Behoit of the University Hospital of Dijon in France, said that using illegal drugs such as cocaine and marijuana illegally boosts the chance of a stroke. So there's something else to consider on this Thursday.